So today I'm going to be talking about what to expect after kidney surgery. So here at Moffitt, anytime you have surgery, you could have kidney surgery for small things such as, kidney stones and those kind of things. But here at Moffitt, we do most of our kidney surgery are because of a mass on the kidney. And it's usually the kind of surgery we do is dependent on the size of the mass and the location of the mass. For smaller masses, we do what's called a partial nephrectomy. On larger masses, we do what's called a nephrectomy. We also do a type of surgery what's called a nephroureterectomy, which is involving removing the kidney and the ureter, but that's involving, it's a type of urothelial carcinoma. But I'm not going to talk about that too much today. So pretty much, majority of our kidney surgery here at Moffitt is because of a mass on the kidney, a small mass or a large mass, and the type of surgery is either a partial nephrectomy or removing your whole kidney, which is called a nephrectomy. And usually those surgery are done in two settings. They're done in an open settings or minimal invasive surgery. A lot of you guys have probably heard we do robotic surgery. We do a lot of robotic surgery here at Moffitt. So most of our partial nephrectomy is done robotically. It's called a partial robotic nephrectomy. And then we also do robotic nephrectomy. And we also do those surgery in an open settings too, and that's determined by your surgeon, by looking at the mass, looking at your history, or your candidate for an open surgery versus a minimal invasive surgery. And usually for a minimal invasive surgery, the length of stay in the hospital is usually anywhere from 1 to 3 days. For an open surgery is usually anywhere from 2 to 7 days, give or take. And that's all depend on how you're doing in the hospital, and your health team is going to evaluate you. Usually full recovery for these surgery is usually anywhere from 6 to 12 weeks, and it obviously is dependent on your patient age, health, and the surgery type you have. Normal activity, we expect to go back to about around 6 weeks, complete healing about 3 months. So what to expect right after your surgery? After you have a kidney surgery, either a partial nephrectomy or a nephrectomy. Usually at that time you're going to have a Foley in, which is a tube that's coming out of your bladder, draining the urine out. You're also going to have a drain in. Some surgeons do not put drains in, some do put drains in, and that's determined at the time when we do the surgery. A lot of surgeons is a surgeon preference. Some likes drains, some don't like drains. There's always an ideology why we put drain in and why we don't put drain in. But majority of the time, you're either going to have a Foley or a drain. Usually post-op day 1, we are going to remove your Foley, which is the tube coming out of your bladder. And the drain also we usually remove in post-op day 1. But before we remove it, we usually test it for urine to make sure there's no urine in that drain before we remove it. There's other factors going to determine if you remove your Foley or your drain. If your drain is putting out copious amount of fluid, the surgical team may want to know what's coming out, why is it producing so much fluid. Also, if your Foley is putting out urine that's very bloody, those things that they're going to evaluate to determine if they need to keep those drain or Foley longer than expected. Also, while you're in the hospital, you're going to have some IV lines in, and that's usually to maintain hydration, to maintain your kidney functions. You are going to be checked with closely vital signs. Obviously, we're going to check your vital signs, monitor your kidney function. At that time, you're going to have some pain, and that's normal. We're going to be prescribing pain management, usually medication to help with your pain. After these surgery, you tend to have some limited mobility, but that's okay. We always recommend it start increasing your mobility to increase your walking, those kind of things within the room. Some of the expected symptoms that you're going to expect to have. With these surgeries, all depend if you have robotic surgery versus open surgery. Obviously, if you have a robotic surgery and it's a partial nephrectomy, you may have 5 small incision, very tiny incision. Usually they're less than 2 centimeters. You may have a bigger one. That's the one we usually extend to extract the specimen from. So pretty much for a robotic partial nephrectomy, which is where we only take part of your kidney, you're going to have about 5 small incisions, and those incisions, a lot of times, they're covered with glue. We suture it in the inside, but we cover it with glue on the outside. So you're going to have soreness around those incisions. If we do open surgery, the incision site is going to be much bigger because it's a much bigger incision. You're going to be much more tender. So you're going to have a little bit more discomfort from those incision sites. You're going to be fatigued, some weakness, and that's normal. Nausea, that's common from the anesthesia that you're going to have. Constipation and gas, that's very normal right after surgery, and some headaches. Usually around week 1 to week 2, you're still going to have some soreness in your abdomen, and that's normal. Fatigue is still going to be there. You're going to have lack of strength, and that's normal also. Some digestive issues, you're going to have some diarrhea, constipation, gas, that's all normal. Your sleep pattern may change a little bit because of the discomfort from the pain from the surgery. Those kind of things, you can't sleep on one side, depending what side you sleep on, because a lot of these surgeries are based on sides, either right side, left side, or lateral. So that's going to cause some discomfort also. Pain management, we usually send our patient home with some narcotics, and we usually recommend to start taking your pain medication as long your pain is under control. Don't make sure it gets too severe before you start taking it. And usually around week 1 to week 2, it starts to decrease, and it gets a little bit better. We always recommend adequate sleep, because sleep will definitely help with the healing process. Start generally, short walks is encouraged to prevent blood clots. Avoid any lifting, pretty much anything no more than 10 to 15 pounds. In terms of what that is pretty much a gallon of milk or a gallon of water. That's what it is. It's about 10 to 15 pounds. No driving until you clear by your surgeon. And usually that's when you're off your pain meds. Usually week 2 to 6, that's when you're going to start to have an increase in energy level. Your strength is going to start to return back. You're going to have reduced in pain. You're going to start get some better in discomfort. You're going to start to feel much better. Your sleeping pattern is going to be better. You're going to start to sleep a little bit more better. Your appetite is going to return back to normal. Your eating habits going to be much better. At that time, you also recommend start increasing those activity levels, like longer walks, lighter activities, gradually return to daily routine. We still want you to avoid strenuous activity or any heavy lifting at that time. Usually around week 6 to 12, that's the full recovery mode. That time you usually go back to work, but it's also dependent on the type of work you do. If you're a desk worker, you may go back a little bit sooner. If you do physical activity or strenuous jobs, it may be a little bit longer. So again, normal activity is usually returned within that time frame. Exercise, as long as it's approved by your surgeon, and usually driving is usually clear by this point. So some of the symptoms you need to call your surgical team about is, one of them is, there's multiple of them here, but all of these are very important, especially if your temperature is above 101, if you have significant pain not controlled by your pain medication, you have sign of infection, redness, swelling, any discharge from your incision sites, you start having some urinary symptoms, such as burning, frequency, blood in your urine, any breathing problem, shortness of breath, chest pain, any swelling, especially in your legs or abdomen, any persistent nausea or vomiting, any inability to keep food down or fluid down. Some of the complications from kidney surgery, obviously you could have an infection, you could have bleeding, because anytime we operate on our kidneys, a kidney is a very vascular structure, so it could bleed post-operatively. You could have blood clots, you could have pneumonia. Those are, some side effects, some surgical risks, urinary tract infection, and a change in your kidney function. So anytime we operate on your kidney, there could be a bump in your kidney function, and that's why we usually monitor the labs very carefully. Around week 2 to week 3, you're going to meet with your surgical team. Usually at that point, you usually meet with the surgeon. If not, you meet with the surgeon APP or mid-level, or one of our surgical APP in the GU department. At that time, they're going to take a look at your incision site, make sure it's healed properly, make sure there's no sign of infections. They can do a complete assessment, assess for your pain, how you're feeling, any side effects related to your surgery, any complication that you had from your surgery. At that time also, you're usually going to have some post-op labs. We're going to compare your labs from before your surgery, before you had your surgery, and after your surgery to see, did your kidney function take a bump? What did it do? Is it up, is down? If it does take a bump, we usually recommend some consultation with a nephrologist to try to maximize that kidney function. At that time also, we're going to review your pathology. And this reviewing the pathology will determine what's the next step is in terms of surveillance. Do we follow you up? Do we add any treatment after that? So pretty much your surveillance is categorized in two risks. It's high risk and low risk. So low risk are usually small tumors, and that's most of the situation we see here at Moffitt. Is usually small tumors, and they're early stage 1 or stage 2. They're low grade. Surgery remove it completely. So what are the follow-up for these low risk pathology? So the follow-up is usually the guidelines of following you every 6 months for about 2 years, and then annually. And what that involves imaging scans, and imaging scans of your abdomen, and imaging scans of your pelvis or your chest. And those imaging scans could be CT scans or they could be MRI. And those scans are dependent on your kidney functions. If your kidney function is abnormal or there's renal insufficiency, your provider is going to make a modification that says, okay, let's have an MRI rather than a CT scan to preserve that kidney function. You're also going to have labs. We're going to, go over all your labs that how often we need to do it. And usually it's a time frame of every 6 months or so. And usually we're pretty good here at Moffitt. We tend to, majority of the time, most patients will see the surgeon the first visit, followed by an APP the second visit, and then we flip-flop it. Try to keep it at least every 6 months to see your surgeon. Is it perfect? No, it's not perfect. So sometimes it goes a little longer. But that's our goal here, is to try to get it every 6 months to see your surgeon. Then we go to the high-risk pathology, which is a larger tumors. They're usually stage 3 and stage 4. They're higher grade, and they have other concerning features, histological features. So these pathologies, we're going to follow you very closely. We're going to follow you pretty much every 3 months for 2 years, and then we're going to start increase your interval of surveillance. Those scans going to be the same, CT scans, MRI, and those scans is going to be based on your kidney function. What is it doing? If you're renal insufficiency, we may do MRI. If you have good kidney function, we do CT scans. Well, pretty much every 3 months, very closely, and we're going to follow you for a longer period of time at that 3 month interval and start increasing. At that time, we're going to have a discussion about the role for adjuvant treatment, which is decrease your risk of any reoccurrence of cancer. We're always going to recommend a consultation with our medical oncology team here at Moffitt to have that discussion with all the risks and benefits of adjuvant treatment, because it's very important to understand the risk before you start anything. So we recommend you talk to our medical oncologist. So the most common questions we usually have: will my cancer come back? Most kidney cancer that are completely removed do not come back, but it's also specific based on your stage, your grade, and your type of cancer you have. So that's why we do surveillance. We want to make sure we catch anything if it does happen. Remember, we're surveillance you. We're watching very carefully, and treatment keep getting better each time. Final thoughts: having kidney surgery and dealing with pathology result can be overwhelming. Remember, you've taken an important step by having kidney surgery. Most people do very well after kidney surgery. Follow-up care help ensure better outcomes. You can live a full and normal life, and we're here at Moffitt to support you.